this back pillow.
Okay. Hello, everybody.
Oh my God. Hello.
We are on. Everybody meaning me.
And me.
And me.
Hello, Becky.
Hello.
Hello, Rebecca.
Hello.
This is nice. How many times? Is this your second time or third time?
On the podcast?
Yeah.
Second.
Yeah, because we did one really even before
Long time.
before Candace got in here.
Still
Are you
getting
okay,
ready.
Becky?
Still getting ready.
Are you sure? You good?
Yeah.
Fucking
Alright.
Crocs out of the way.
Everyone stop
Yeah,
making noises. How do you feel there?
Good.
Are you comfortable?
Yeah, I'm good.
Excellent. Becky did a podcast with me few episodes in and we talked about grief and it was very, very good. Did you listen to it?
Yes, but the sound quality was very bad back
Yeah,
then. So I
that was
stopped.
before we,
yeah.
Where
in the
were we?
kitchen
We were in the kitchen downstairs.
Yeah.
Yeah.
And I think it was COVID-y time.
Yeah, yeah.
Pre or...
Maybe just at the start. Oh, I can't even remember.
I think
Don't
maybe
ask me
just
about
before
time.
it all kicked off.
I don't know.
Can't
But
remember.
it was, we had a very good discussion though. So
went for a long time.
Yeah. If you can put up with the shitty sound quality, I recommend listening to it because it's very good.
And I made Anna Mickelberg cry.
In that podcast,
Holy
Yeah,
shit.
when she listened to it.
to it.
Yeah.
That's like you should put that on your resume or something. That's some kind of
Well,
Record.
yeah,
like
some
a
kind of
tear,
award.
but
Just with one single tear.
And
That's a cry.
it burned her face the whole way down.
It's like I haven't felt this before.
That's good. Yeah, no, it is. It's very good, and it's very. You did a lot of research for that yourself, and you knew so much about it already, which is very cool.
Yeah.
So yeah, I would highly recommend listening to that. I learnt a lot. If Becky gets up throughout this podcast, she's going to in around 26 minutes, I reckon.
Yeah.
And she's going to get up and reset our video. So that's what's going on there if she just leaves.
Yeah.
Hopefully she's not mid-cry.
Yeah.
Hopefully, maybe that's
No
why
crying.
she'll leave.
Yeah,
No,
she,
no crying.
no crying? No. Nah. Not
No,
talking
we're gonna
about,
make Anna cry again.
Oh, okay.
The goal for today. I don't know how.
we're not talking about grief today, guys.
No, I know, but we just got to get her somehow.
Why am I holding
Two
this?
from two,
This
I don't
feels
know.
good. I'm going to hold it. I've never held... No, I'm not. So, Becky,
Yeah.
you
Wait,
are...
we have to do question of the
Oh,
day
sorry.
first.
Okay,
Jesus.
sorry. Go, Candace. Oh, which one is that? Is it B?
Yay. Okay, today's question of the day. This is quite good for Becky being here as well. If you worked at Bunnings, which aisle would you work in? What would be your specialty area?
I think I just go straight to garden
Oh, yeah.
because I like plants.
You do like plants.
I love plants.
Yeah.
I do. That's probably where, if I was to go to Bunnings by myself, that's just where I go.
Just straight outside.
Yep.
Mm-hmm.
Straight in like the undercover plant area, like just before outside, like that little
All the little, these
indoor
little,
plant. Yeah, these guys. These guys.
and the pots as well. I love
Yeah.
looking at pots.
Yeah.
Mm.
That's where I would go.
Mm-hmm.
What about you?
I feel like, I don't know why, but I'd be in the paint section, just playing with all the
mixing.
colours. Yeah, I don't know why. That's just what first came to my brain.
It's so good. I don't know why I like it, but
I have no experience with
like
I'm a
as
terrible
soon as
painter.
you said paint section, I pictured you in an apron.
Yeah, exactly.
And you behind the paint counter.
Giving advice to paint.
Sorry, I just got to mix this one up, guys. I'll be with you in one moment.
Yes.
I can see it.
Yeah,
Yeah.
that's what I would
Yeah.
do. What would you
Hands
do?
everywhere. I really hate Bunnings. But,
Becky's husband works at Bunnings, for those who don't know.
probably the outdoor furniture.
Okay.
Barbecues.
You're a bit of a
Some-
barbecuer,
No,
are you?
but then I
Say
can
when
sit
you're a
down.
painter.
It's normally near the cafe, like there.
And like the outdoor furniture, like the chairs
Yeah.
and the lounges.
Yeah.
You can see you near that lounge.
I'll just be there like.
Yeah. Where does Mitchell work at the moment?
He's now just moved to and managing. Can't remember what it's called, but it's garden and outdoor furniture. That bit.
Oh, fun. Do you guys would work together? Cute.
They
You'd be your
could.
boss.
He moved straight away.
So would she. She would
Yeah.
move. She would move centres.
Imagine him trying to tell me what to do.
It would.
I would
Someone's
pay
getting,
you money for this.
someone's getting fired. I'm not sure if it's you or him, or you both will end up fired. Who knows? Now can we talk about?
Yeah,
Becky?
you can
Okay,
go now.
great.
Oh, sorry.
Okay, so Bexa is behind the scenes on our podcast only since end of last year.
Yeah. Did a few before the
Yeah.
end. Yeah.
Yep, and yeah, she's our producer Becky. She works at the gym. How long you worked here for?
Oh, I don't know. It was such like a gradual
It was, wasn't it?
weaving in.
You're like a bit like Candace. You
Yeah,
just
yeah.
weasel
weasel
your
away
way
in.
into all of the things.
I'm waiting for you to take my job.
Just waiting for it to open.
Yeah.
And then I'm in there. Well, it started with photography.
Yep.
I did that was
Straight
pretty
away.
early on.
That was like, yeah. That was as soon as I found out you were a photographer, I was like, you.
Yeah. I did barbells for boobs.
Yeah.
2017, I think.
Yeah.
And then from there on in, I was
Yeah.
the photographer.
The photographer.
Um,
Well, maybe let's start as a member. When did you join?
2016,
And
April.
why? How did you find us and how did you join?
Do you remember?
How you found?
Yeah.
Oh, no. I might when
Okay.
you remind me. You, Mitch, and Corey all joined together. I came
yeah.
for a trial.
Yeah, I came first because there was a Facebook competition. I don't know, it just popped up on my phone.
Yeah.
Scrolling through Facebook. You had to answer a question for one free week at the gym. And it was, why do you most want to train? And I just put abs. And I won. But I don't think I won. I think everybody won.
I was going to say that was
Yeah.
marketing strategy 101 back in the day.
Oh my God, I won.
Maddie, Bridie and Maddie, she also won.
What did she
Did
say?
she? Back when she first
Won.
joined?
Oh, no, she actually won. Her and Emmy won.
Yeah, cute.
So I used to do, when it was just me trying to get some members, I used to run little competitions into each booty camp or each beginner program. So I used to give away an entire course of free booty camp, and anyone else who entered, I would offer them a free week. So it worked. It was great. It was a really good little way to get people in
That's
the door.
awesome.
And Maddie and Emmy both won. They
Yeah,
were like, for
cute.
some reason I had 2 winners that year. Maybe I didn't have many signed up. I don't know, but it worked.
I mean, it's worked out okay.
Yeah, it worked out pretty good.
Yeah.
So you and your abs.
Yeah.
How are those abs going?
Still trying.
It's been 84 years. That's so good.
So I came in and just watched a session.
Is that what I told you to do?
Yeah, I think there was a few messages back and forth. I was a little bit unsure. So he said, just come and watch. And in that initial meeting, I said to you, I'm just scared that I'll get too bulky.
How is that going for you?
Still trying. Really hard.
You were so little though, and you had never done anything like it.
No, nothing. No weightlifting whatsoever. Running, swimming, dancing, horse riding.
Dancing.
Yeah, that kind of stuff.
Yeah.
If I'd been in a gym before, I would have just been on the treadmill.
Yeah.
Did you know when I first started working here, you were the first person I ever coached?
Really?
Like ever.
Oh.
Yeah.
That's cute.
I was thinking about it last night. We used to open on a Sunday. And I
That's
covered.
That's how you started.
That's how I
weaseling
started.
your way
Yeah.
in.
I was like, I'm going to clean the shit out of this gym. So she gives me a job. And then Becky came in for open gym. And I was like, I'm going to coach the fuck out of this girl so I get a job. And you're the first person I ever coached. Yeah.
What did we do?
Squat. You were doing back squats. Yeah.
So cool.
Yeah.
Back in the day when we opened on Sunday. We're not opening on Sundays
Not
ever
doing
again.
that ever again.
Yeah. So never done anything, and I couldn't squat. Was doing wobbles.
No. Can I go into that?
Yeah.
She couldn't squat. Like she couldn't air squat without putting her hands on her legs to get back up.
Yeah.
Do you remember that?
Heels would have come up.
Yeah.
I'm pretty sure. Would have been on my toes.
Yeah.
I was like that dog doing a shit. I'm doing it.
Okay, you need to put a picture of that into that little short.
And that was the first time I ever had to work on my facial expression and not be in shock. No, I'm joking. No, but I was like, wow, like this chick is young and not at all strong. Like she has no strength. And look at you fucking go now.
So cool.
Years on. Every time I see you do wall balls, I'm just like, you threw that fucking basketball against the
Yeah.
wall for so long.
Yeah. I was
She
like
couldn't.
basketball, but I didn't know any different at
Yeah.
the time, so I was just like, oh, okay, cool.
Yeah.
I didn't know that kind of what people would be normally doing in a CrossFit gym, which is throwing a 4 to 10 kilogram ball. But yeah, there I was with a basketball.
Yeah. And then so you did you did chat, trial, did you bring Mitch and Corey back for the first workout, or what?
I think I did my week.
Yeah.
And then
Your
and
free
then they
week.
were in. Yeah.
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 And then you brought Mitch and Corey, and I was like, these three are going to be fun.
And fun they were.
Very much.
It was like fairly early days. Joe was coaching quite a lot, and me and Corey were being taught the snatch. And Joe was hilarious. She was like, just think, like, drop like a stripper. Corey's like, I love this woman. And then there
He was like, okay.
There was a few more things, and she's like, she's quite straight down the line. Like, you need to do this, stop that, do this. And then for some reason we had to go on a 200-meter run. She's probably just getting rid of us. Just go out for a bit.
Give me a fucking minute.
Me and Corey were like, should we just keep running? Just don't go back. But we went back.
That's so good. I'm glad you returned. And then, so would you say between the trial period, like the first few months, were you like, this is awesome? Or was there a lot of like, I don't know if this is for me in the beginning? Do you remember that far back?
No, well, I don't remember that far back, and I don't remember ever thinking this isn't for me. Like I said, everything was just unknown. Everything was new. I'd never done anything like this before, so I was just taking it all as it came, and I can only remember just loving it. And being like interested in it from the start, and
So
wanting
cool.
to get better from the start.
That's so cool for someone who had no background in this, because usually people who fall in love with it come from like a sport, and they're like, oh, this is like another outlet, but you just loved it because you loved it.
Just
That's
like,
really
oh,
awesome.
This is cool.
Yeah.
Interesting.
This CrossFit thing.
Different.
Yeah.
Stuff.
And then, so you've been around for like one of the longest, since we've opened. Would you say, what have you noticed between early days to now? Like, what's changed with Contessa? Is there a difference? Like, it's also hard, like different because you're on the other side as well, being a staff member.
Yeah.
But do you think back to those days compared to now, and what would you say is different? Or the same?
Everything but nothing. Like, the core of it is the same and has always stayed the same. But if you were to go back in time and look at it then in that gym, and go back and then come back in time, come
Back to time.
it would look so different, feel so different. You'd probably have a different experience, but the core of it is still the same.
Yeah.
Which is empowering women, getting people fit, strong, healthy, and the community as well.
Yeah.
So I think all of that has still stayed the same. But to see it visually is, everything has also changed. Does that make sense?
It really does. And that's how I feel as well. Like, from the very early days to now, like, the goal has never changed. I don't think the vision has changed. Everything year on year changes because that's how things evolve and get better, and we change things. But yeah, the overall, as you call it, the core, like the mission and the values of the whole thing have never changed. And I think time is weird, and like, it's just bizarre. Like when you look back at old photos or old videos, and you're like, that is so different, but not.
Yeah.
I think it's like refined almost. Like, it's like the purpose has always been the same, but I think it's gotten the way you and we go about achieving that purpose has just gotten like better and better, and like tighter and tighter every year. So that makes sense, I think.
Yeah, and that's always what I loved about, as I got to know the place more and more and was working in it and things like that. I just, like, you often do hear people say there's always something new going on, like nothing ever like stays the same, like things are changing. But I loved that. Like, I love change. I love kind of like adapting, learning, growing, which it just does all the time. And I don't think you would have got this far if you didn't do that.
No.
Like,
I don't think, like, I don't have any other experience in any other business, but I don't think as a small business in Queensland, Australia, you can stay the same. You have to always like be better. Like
Yeah.
you have to constantly be thinking forward about what you're going to do differently next, better next time.
Yeah.
Because someone's going to be doing it better if you're not doing it better. Like it's
Yeah, and you're never like right, like yeah, like
Mostly
whatever
wrong.
whatever you do, it's always like, oh fuck, like I should have done it like that, or we should have tried that instead. And they're like, okay, next time let's do that.
yeah.
Yeah.
It's like you're never done.
Yeah.
Not being afraid of maybe getting it wrong. Like just going for it and trying it and making it better for just always trying to make it better for people.
Such a metaphor, like CrossFit is such a metaphor for small business, really, isn't it? Like
Yeah.
that's literally how like you can, and a lot of people do attack a lot of workouts. Is like, oh, fuck that one up.
Yeah,
I'll try better
Learn,
next time.
do better
Yeah.
next time. Yeah.
So it's very goes hand in hand. Speaking of CrossFit, so you've done CrossFit for how many years now?
9. Sorry.
Mad.
2016. No. 2016. What are we now? 2025.
Yeah. That's right.
It'll be a 9th year.
9.
6 to 5. You know,
Simple math.
I could have done it for you. I just wanted to see you struggle on camera. What has been one, like, is there anything that stands out? Like you say, you like the change and you like adapting to change and things like that. But doing this for 9 years, is there anything that stands out that is a bigger challenge than others? Like in terms of training?
In terms of like...
Just the fitness side. Like just like your fitness and health side of things. Like what is a struggle that you either didn't expect to be a struggle at the very beginning or you didn't expect to still be struggling with? Is there, take that question however you like.
Getting strong.
Yep.
I thought I would lift a few weights and be like the Hulk. I'd like touch a dumbbell and be like, boom.
Thought you were just going to be big straight away.
It takes so long and so much work, and people, you do see change, but you do have to constantly be looking back. So, like looking back to where you started. Otherwise, you can feel like you're not getting anywhere. Feels like such a slow process. Feels so hard. But then you look back to the beginning and go, oh, okay.
I'm doing good.
9 years. Yeah, I'm doing great.
Have you gone up and down with strength in the 9 years? Like, has it been a constant slow growth or has it been up and down a lot?
It's been a constant slow growth with lots of little along the way. I don't think I've ever had a time where I've noticed it like drop down dramatically or peak dramatically. Probably a period of time where it was just like the same.
Yeah.
And then maybe going up again now. But yeah, really slow, small steps along the way, up and down.
I would say like the entire time I would say that you're someone who has trusted the coaches. I don't ever feel like you're ever someone who's questioned the programming, questioned the coaching. I feel like you put a lot of faith and trust in what we do and you believe in it. Has there ever been a time that you have been like, I'm not getting strong because the coaches don't care about me or the programming's not good enough? Like, and if not, why? Like after all these years, like...
Good question. I don't think I've ever looked... I've questioned why am I not getting stronger? Like into myself, like why am I still not able to hit this or that? But I've never thought it was for an external reason. Always just thinking, what am I not doing to get better?
Yep.
No, I've never looked at coaches or programming or anything like that.
Yeah. And I wonder, do you think that's just her personality? Do you think that's just...
I don't know. I kind of just feel like it's also just like starting with no background in anything,
So
like
like
just
no
no
expectations.
Jinx.
Yeah.
That means I can't talk.
You can't speak. Get out, bitch. This is our podcast now, Becky. No, I'm kidding. I've forgotten the question.
You have to say my name to unjinx me.
How do I do it?
You have to just say my name.
Amanda.
Yes.
Is that all you do?
I think so, isn't it?
3 times.
Oh, 3 times.
Wait. No, I do have a question now. You've been doing this for a really long time, and there are still movements you are trying to achieve. How have you stayed so, like a thing we talk about all the time is not looking sideways and not looking at what other people are achieving. How have you stayed so like good with that? Like you've, and I could be very wrong, but to me, you've never really been like, oh, like she can do all these things and she's only been here 6 months, but I've been doing this for so long. Like, has that ever affected you?
Yeah, I won't lie. That goes on in my head, definitely. But I try and pull myself up on it fairly quickly.
Yeah.
I think it's good to be around people that, and listen to like podcasts and things like that kind of like help you put things into perspective, can talk to you guys. So yeah, it goes on in my head for sure, but I've gotten better at knowing where I'm at.
Yeah,
and
that's really cool.
knowing that my story and I am not that person next to me.
And that doesn't like take away anything from you.
No, I think I still want that. I don't not want it. And I wouldn't ever not strive for that eventually. Or have it have it as something to aspire to. But to me, that's like certain movements and stuff are way off. They're not even in my vicinity at the moment. Like, so yeah, I mean, I won't lie, it's really hard not to look sideways. And through certain periods, it's been really hard not to be jealous of other people, or kind of think, why her, why not me? That still does all go around, but they're just thoughts that you gotta like.
I think from having chats with you about that sort of stuff, I think you're really good at having a pity party and then moving the fuck on with it. Like you will not maintain a victim mentality. You will do it for like a day or a week or whatever it is. And then you'll just go, well, this is actually not helping me.
Yeah.
Like, move forward.
Yeah.
So you'll have it like everyone else, but you just won't live there.
Yeah.
You won't stay in that.
And there's certainly been like times like that. Like the Open is the first one that comes to my head. Like there's been a few where I've been crying, like at the end of it to you guys.
Yeah.
Or you'll come up to me and be like, what's up? Like, I'm just behind the camera like, nothing. I'm fine.
It's pretty much exactly how it goes. I'm like, okay.
You can see that in me, like both of you. We've been around each other long enough now where you can see that. And I internalize a lot as well. So I would try not to let it show on the outside. Did you ask me a question?
No, I was just saying that.
No, she's still jinxed.
I fucking unjinxed myself. Amanda. I think I just said that you're good at not staying there, not staying in the pity party. You can move on with it.
Yeah.
That's my observation. I believe you can pull yourself out pretty well.
Yeah.
With a little slap across the face, whether it's you that does it or one of us that does it, you're pretty good at getting on with it.
She's pretty good at doing it as well. Yeah, it definitely goes on, but yeah, I would agree. I'd say I'm pretty good at parking it.
And I think the other thing that I notice when I'm coaching and you're in my class, like everyone's aware of where everyone is in a class environment. It's part of group training. Like what's going on around you, but the thing I love about coaching you is you, regardless of how you feel and what's going on around you, you'll always put in like your 100% that day. Like that's never been a question for coaching Becky. And that's why she will continue to like have those little bits where she goes up and down, but she will keep that upward trajectory. Did I say that word right? Felt wrong.
Go again.
Trajectory. Yeah. Felt wrong.
I think the first time sounded weird.
Trajectory.
Too much lip and tongue and
trajectory. Okay, moving on from trajectory. She will always keep moving up because of the mentality she has, like the not victim mentality, and she'll always put in work, and she's very consistent. Like those things make up for regardless of background and how fast you're moving, you'll always keep moving forward because of those things.
Yeah.
9 years training in the one place with the
Yeah.
same people, with the same coaches, like, you're doing fucking great. And the fact that you're continuously getting better, like, it's pretty cool.
It's very cool. It's very, very
Yeah,
cool.
I do sometimes think, why the fuck am I still here?
Thanks, Max.
What's that?
But like, wow.
Yeah, it is cool. It's very cool. Like, I don't think we'll talk about that off camera.
Maybe I'll go and do the thing right now.
Maybe you
Nearly time. Oh, there's a few more minutes, I think.
No, go do it now. Because
should do it now because it's at 25 minutes on this, and we started that earlier. I'll just talk at you while you go do that. Yeah, because I would say most people, I don't actually know the stats on CrossFit gyms, but I would say most people wouldn't even last 2 years.
Yeah.
Like
I feel
training.
like 2 to 3 years comes to my brain, but I don't know why. But yeah.
The average like life of a member. I know it's higher here. We've got a really good retention rate for members. But I don't know the average CrossFit gym. I know a normal gym wouldn't even be 12 months.
Yeah. Fuck.
But yeah, the fact, yeah, it is. Why the fuck are you still here, mate? That's a solid question. 9 years is, yeah. And yeah, just like the same, like when I'm coaching you and I see you with a heavy barbell on your back, I still get very excited because of where you started. Because I still have that picture in my head of tiny little Becky using her hands to stand up an air squat. Like, I think it's very cool. And like, not just for your performance throughout your 20s, 30s, and soon to be 40s. How old are you again? 38?
38.
Nearly 30?
Nearly 38.
Nearly 38. I'll know her in 3 decades soon.
Crazy.
That's pretty cool. But also just for your old ladiness, like how cool, like if you didn't start this now, like who knows how difficult it would be to if you started
We won't be able
it
to
now.
rave if we don't keep it going.
Yeah.
Becky and I send each other videos on Instagram all the time of old ladies at raves, and we're like, this is going to be us.
That's you in the paint shop at Bunnings. mix.
Jesus Christ. Just a
That's
couple
what we're going to do.
old lady ravers. I'm going to be the opposite. I'm going to be on the beach.
You can meet us
And
the morning
hiking.
after the rave.
You guys will like be walking down with your whistles. Morning, guys. Just going for my 6K hike. See you at my dumbbells.
I think another factor as to why you're so good with all of that stuff is some of the things you've had going on in the background. You've had a lot going on the last couple of years. If you want to talk a little bit about that.
Where did it start?
Yeah, I mean, a long time, really. 2000 and... I think of it from 2018. Any maths people here?
Like how long ago that was?
Yeah.
7.
7 years. I'd say 7
Candace
years.
didn't need her fingers. I just went like this.
Yeah, there's been stuff going on for 7 years.
Yeah.
In the background, maybe not in the background, I don't know, in the forefront. So yeah, in 2018, so 2 years into it, was it you? I can't really remember.
I don't know if it was the first time. I just remember saying, I don't know if I was coaching. Me and Joe were both there. You were on a rower, and I walked over to Joe and I said, Becky's head's doing something weird. What the fuck's going on? Yeah. And she was looking at you and she's like, and then she noticed it too.
And I think Mel V was coaching at the time as well. And I think I remember her kind of coaching in those early days and also noticing. And
you didn't even feel it at the time.
I didn't even feel it. I had absolutely no idea, like completely oblivious. And you said to me, I think I was on the rower, and you were like, did you know that you do this on the rower? Like when you pull, your head turns to the right. And I was like, no, didn't know. And then...
It was so small though. It was very, very slight.
Yeah, very slight.
But almost like...
is that an exact point though?
Yeah, and it was so repetitive, like every single time, no matter how tired you were, no matter how fast you were going, like it would happen at the same point.
Yeah, at the pool, like back. So it was kind of just like, oh, all right, interesting.
Weird.
Weird, but anyway.
Carry on.
And when I look at like back at videos pre that, so between like 2016 and 2018, it wasn't there before. So like in the limited videos I've got, like deadlifts, wall balls, I think there's some clean and jerk videos. There's nothing, like you see nothing. So it's something that had come on gradually or suddenly, don't really know. And then it's a little bit blurry that bit after that, because then it's kind of just like oh, that's interesting. And then I think it was like let's just keep an eye on this kind of conversation. And then perhaps...
I feel like it didn't get worse for a really long time.
It was probably a couple of years before it got bad. So it gradually just got worse, and then we'd notice it in more and more and more and more movements. 2015, I think, I'd had a car accident and had whiplash. So I was still going through that process in the time, and I had an insurance claim as well. So that went on for like 2 years, the whole thing. And for anyone that's been through an insurance claim before, it's like not the most pleasant experience. And I mean, they're just doing their job, but you have to go to lots of like external people from the other insurance companies so they can assess you.
And they're almost trying to like poke holes in your story,
yeah, they're
so you
trying
don't have to
find,
pay.
Yeah.
Which is stressful.
Not the lies, but that's what you feel like.
Yeah, that's what they're looking
It's
for.
like it's the same as when I leave a shopping centre and someone wants to check my bag. I haven't stolen anything, but I'm like, I feel like I've stolen something.
Yeah.
So imagine like that, but much worse.
Yeah, and for a long time, it was 2 years of that.
Yeah.
And genuinely having pain, discomfort, and learning a brand new skill, many brand new skills and strength training and things like that. So, I had 2 years of that. I remember being in Brisbane, and it was me and 3 others from this insurance company, and they were just like, I felt like they were just like at me, like trying to like
Break you.
yeah, like, but and then soon after that meeting, it kind of all finalized and was done. But I don't think I realized how much of an impact that had on me. Like, you're kind of just going through it and it's in the back of your mind. But whether that had a lot to do with it, I'm not sure. So then, so 2020, I was seeing Dave at Sports and Spinal, who's amazing.
Yeah.
And I was put with him after my car crash. So I've been seeing him for a while. And then I mentioned to him what was happening in the gym. So he was like exploring that with me for a while, referred me to a GP with the possible diagnosis of cervical dystonia, it was at the time. And I remember coming to you in the gym by the kids' cage and being like, I've got cervical dystonia. I didn't even really know what it was. But I was
Just had words.
Candice was like, there, we can do this.
It's like, it's not even that bad.
And then from that moment, my option was to either manage it myself or go to a neurologist, and I decided to try and manage it myself. So then that was like another.
Shut up, you would too. The same person, you two, in so many ways.
And in my mind, it was like, well, I didn't have this before, so I can
get rid of it.
Make it go away. So I think at that point, that was probably like transitioning between that gym and here. It was early years,
like
here.
COVID-y kind of time. Yeah.
And
there's a lot going on.
And like when I say I'm managing it, like I'm also like, we're doing it together. I feel like I've got people doing it with me, like because here was one of the only places where it was happening at the beginning. So during that time, I think I took a lot of movements away. So the thing is, nobody really knew what was going on. Like from a coaching perspective, like when I don't even know what's happening, I don't even know how to control it. I don't know why my body's doing this. Like that must be so hard for a coach to know what to do with as well.
I would definitely say, like for me personally, I wasn't super stressed because it didn't hurt you.
Yeah.
So
yeah.
like it was confusing as fuck.
Yeah.
It still is, but it didn't hurt you. So
Yeah.
it was like, wasn't terrible.
Yeah. In the moment, it wasn't like it was happening and it was like, ow, or
Yes.
like an injury. You'd be like, oh, no, that's hurting my shoulder.
Yeah.
Like there's none of that. But pain was a huge, ongoing, consistent thing.
Yeah.
Just not with them. It was just like all the time, not
all
just
the
with
time
that
pain.
thing. Yeah.
So I remember just like almost always holding my neck like this, like in the coffee shop. I'd just be like, I'd stand like this a lot. Like I'd like be stretching to the side. I'd be like digging my thumb in to try and like relieve the pain a little bit. Like, so no, it wasn't like an injury where it hurts when you use it. It's just like a consistent, dull, tingly, throbbing, achy pain, like all the time.
Doesn't let up. Like it's just taking up brain space constantly.
Yeah, another thing just there in the background. So then that was the way to manage it, was to not do the movements that it like aggravated it the most.
Which was, what we take away? Rowing
was like definitely one. Deadlifts was a bit later. That stayed on for a little bit.
More like the powerful
cleans,
things.
like the cleans, snatches, pull-ups, any kipping.
Yeah. Anything like with like velocity, I feel was bad.
Yeah. Anything where like power to extremity stuff. Like
That's a good word. CrossFit.
Yeah, CrossFit.
Feels good.
And then I was even out the back for a while.
Yeah, we were like,
during
let's
that
just
time.
try some like strength training.
Yeah.
Yeah.
Which
You also did so well at, like...
Yeah. I was like, this bitch is going to get so strong.
Yeah. And I loved it at the time. Like at the time, that's where I wanted to be. I didn't really want to be in classes at that time because...
It had gotten quite bad as well.
It was pretty... I'd say that was probably at its worst at that point.
Pretty self-conscious of it overall.
So self-conscious, embarrassed, just thinking people were talking about it, like, being upset because I can't do stuff when I wanted. I'm here because I want to do all that stuff, like, but I couldn't. So I really liked being in that, like, out the back, just doing my own thing. Like, it just kind of like cleared the headspace a little bit. Didn't think anyone was watching me, not that anyone is, but it just gave me a bit of protection at the time, I think. And could work on getting strong, still seeing improvements, like strength improvements and things like that. And then
so that was was that a couple of years doing that, wasn't it? Like managing it yourself was a couple of years. Like it was like a slow progress, so slow out of class, and then I think it got pretty shit. I think you just weren't getting better.
Yeah.
Candace was like, she's fucked, she's gonna die. No,
she didn't say that.
Don't know what to do with her anymore. Like,
and then I think you recommended.
Yeah, and then I think.
Did you give her someone else to go see?
I think we talked about it a little bit, and I was like, let's look at like pain specialist.
Yes.
And neurology, like as a next.
Yeah, I can't
point
remember.
of call.
I think
can't remember.
There was probably some conversations. I just kind of decided that I didn't want to manage it myself anymore.
She was like, I've made the decision for myself that I would like some help now because I've made that decision.
So I went back to the GP that Dave had previously referred me to, and then he referred me to a neurologist. That's when I started Botox.
How long ago was this?
treatment.
Oh, that time was wild. That was a wild time.
And that was a year.
That you did
of
Botox?
Yeah.
That was crazy.
So that was the option because you developed such a like a height, we call it hypertonicity, like a so tight and active in one or two muscle groups on that side.
And almost like this right side of my chin, which still is a little bit now, but it was like the muscle had developed like here. So this side kind of went in, and that side you could feel it. Like,
are there many conditions that people like physios or whatever, like we would use Botox as a as an
neurological
option
when people start to develop like that, or like a spasticity in those muscles, then
and at that time as well, the diagnosis was still cervical dystonia. So
you never accepted it?
No, because when you Google stuff, obviously you look into it, and it kind of was like just didn't really sit right. It's like, well, this is what they've told me, so this is what I've got. But it kind of made sense in some of my symptoms, like it's a pull to the right, a spasm. So yes, that's what's happening to me. But yeah, if you Google it, there's the people that have cervical dystonia really bad are like suffering bad. Like some of the videos and pictures out there, they're like constantly in like a fixed position, some of them. So
That's
I don't know, it just didn't quite sit right, but who am I to question it really? But it just feeds into that whole, why is my body doing this, and not understanding your body and feeling out of control. You've got no control over what's happening, and nobody seems to know what the fuck to do. So yeah, a year of Botox, which...
And that was like...
So the Botox process, they inject it. It took a couple of days.
Yeah, it takes a couple of days to set in, and then you have to wait 3 months before you can go back. So you basically have to let that wear off, and then you go back and you do it again. And it's a diagnostic treatment. Like they kind of test it out. So try this spot. This is where it makes sense. Okay, that didn't work. 3 months later, try a different spot.
But even then, remember the doctor that was doing it, I was like, ask about this muscle, this muscle, this muscle. And he was like doing the opposite. And I was like, no, like that's the wrong thing.
Yeah.
And he kept just being like, no, like this is what we need to do. But it never...
All I can remember from that time is you doing fucking pull-ups.
Oh
and
my gosh.
it was stress.
Yeah.
Like that
baby
would
head.
Yeah. Like
Yeah.
little
Yeah, it's
bobble
like you
head.
lost all control of your neck.
Yeah. I couldn't sit up in bed without holding the back of my head. It would just flop back like a newborn baby. There was no control. Sit-ups.
Crazy.
Couldn't do those.
And then each time you'd go back, so like 4 different times if you did that for a year.
Yeah.
3.
Yeah.
So it was a different time, so then we'd have to find different exercises that you could do and that you couldn't do. And it would come up in class, you'd be like, whoa, not that one.
No.
Like,
yeah. I lost my head.
and I can't imagine, like, looking at it, like, it looks bizarre. I can't imagine how that would feel to do.
Yeah, it's horrible feeling.
And just like the fact that it wasn't working, but he just kept persisting with it anyway. Like it was just a bizarre...
It was not it wasn't nice.
Yeah.
I never really felt listened to. I was always so anxious to go. I was like rehearsing what to say to him and hope that he'd listen.
I remember we made like a little speech one time.
And this is what I said. Hello.
Then Becky's like,
Oh yeah.
excuse me, sir.
Yeah.
He was like, sit down.
Yeah. He was always pleasant, but he just wasn't listening to me.
Yeah.
And if you saw the clients that were going in for that kind of treatment, they were all over the age of 70, 80. Like I was the youngest person in there. Just did not feel right. It just didn't sit well. But again, you're like, well, this is what I need to do to try and get better. So then that's another year. Kind of felt wasted, but it's now looking back, it's just all part of it. But I was like pretty low at that time, and the pain gets worse as well with Botox. So yeah, some days it was taking everything to just like hold it together, because it just does take so much out of you. The pain is tiring, like it's so tiring. So after that, I was like, what do I do? I went back to the GP and asked for a referral to a new neurologist, because that was the main thing. I didn't feel comfortable with this guy Didn't feel listened to. The Botox clearly wasn't working. If it was helping in some way, it was making new problems. So that's not great either. So had to then wait for the referral to this new neurologist, Dr. Karen Sank. So she works out of the uni hospital. That was a long process because I had to go to a new GP. So it was like starting from scratch. So I was basically going to this new GP saying, I want a referral to a neurologist, but she's never met me before. So it was a lot of like explaining and trying to like persuade her like that this was right. Had a scan.
That's right, had an MRI, yeah.
Which initially showed a spot on the left frontal.
Yeah, showed some like plaque, I think, in some areas. And then we were like, fuck, she's got MS.
Oh, Jesus Christ. I don't even remember that. Must have blocked it out.
Yeah.
So then I was on aspirin daily.
And then they were like worried that, they were
worried about stroke,
throwing a
and
clot.
things like that. Yeah.
I definitely blocked that out.
She sent me the report and I was like, oh, you need to go back to the doctor now.
Yeah.
Yep.
So had my initial consultation with Dr. Karen Sang. The new GP was then quite concerned. So she was like, you need to get in as soon as possible. Stay on aspirin until you're in to see the new neurologist.
Worried about like clotting?
Yeah, I think so.
Is that what the aspirin's for?
Yeah.
So I had lots and lots of like thorough testing, which I'd never had before with the other neurologists. So it was just straight injecting Botox. Lots of testing. She couldn't see anything that fit with cervical dystonia. So she was the first person that questioned that. Went back again for a couple more, like they stick a probe in your muscle and then
like
you have to
nerve
move.
conduction studies and stuff.
Yeah, so they're just seeing like how your muscles,
like
the
respond.
reaction of them, if they're overactive or underactive, I think.
Kind of, is it this kind of like the knee test?
If it's what I'm thinking of, they're checking, like, do they put like a pulse through the...
It was like a needle and then she was looking on a screen.
Yeah.
Almost like an ultrasound type thing. And then she'd get me to like move my arm in different directions to see wherever the muscle she was in, how it was responding. Okay. So she was like going up the neck and like down the trap and stuff. And nothing. Everything was normal. So at that point, I think this was the second time I saw her, so she'd already had a little bit of information prior, so maybe had an inkling. And then the second time, she was like, everything's normal. In my mind, I'm just like, what is wrong with me? Like, I'm not making this up. She then diagnosed FND, so that's functional neurological disorder. So new diagnosis now.
How long ago was this?
That was like maybe a year and a half ago, I think. So fairly recent. Like when you think 7 years, this is still all quite new since that second diagnosis, which I have now. So she straight away put me on pain medication, so amitriptyline. Still on that now.
Helping?
Yeah. So the pain is almost non-existent, I'd say now. Like it flares up, but then I've got things now that I can do to kind of like get that back on track. So yeah, I mean, it's not fully better. It's something that I'm going to have to always work on. And it flares up sometimes.
What flares up? Pain?
The pain, yeah.
But you know, like what triggers cause that now? Yeah.
So things now, the main thing would be, okay, what's happened in the last couple of weeks, stress-wise, sleep, perhaps something that I've done here in the gym. If I've just done a bit too much, it's mainly that kind of stuff now. Stress probably would be the main thing.
An old stress. Everything, eh?
Literally everything. It's crazy.
Yeah.
Just it's like it's how we are handling an external thing.
Yeah. And stress can be anything.
But what we're doing to ourselves with it. That's the thing that blows my mind. Is like when I think of my autoimmune, stress is the biggest thing. Like that's the biggest thing, is how I'm handling stuff.
Yeah.
And like from external whatever. But it's just so interesting to me that it's how we have taken it on and what we're doing with it that is like making physical ailments. It's just crazy.
Yeah, it's so interesting. And it's like stress, because I know we've had this conversation a couple of times, can be so many things. Like people think of stress as like, oh, my job is so busy, but it's literally, did you not sleep? Are you and your partner bickering a little bit in the background? Are you worried about school starting next week? Like all of those little things.
How much you did in the gym.
Yes.
Like physical stress.
If your cup is always at, say for people who have an issue, 70%, your ability to tip over into overflowing is this much. Like it doesn't take a lot. And I think for you, unfortunately, you had to learn that the hard way.
Still learning it.
Yeah. How
Still
much.
learning it.
Because it's so inbuilt in me. I'm having to undo a lot of stuff from like years and years and years and years. And stuff that I learned from probably when mum died. Like in that time, my reaction to that, I had like a month where I'd kind of like let myself grieve, and then I was straight back into uni. Didn't accept any extensions on my work, was just like full, like hit the ground running, was just busy, just kept myself busy. And like with uni, I'd get like kind of reinforcement from that because I'd get like praise and like, oh look, I managed to finish on time. And so just kind of like that, and that has just been me, I think, ever since then. So it's having to...
How many years is that?
More counting.
More maths.
Lots.
I was probably 20.
Yeah.
20.
It's just short of 20 years, 18.
So that's a lot of undoing. So yeah, this is going to be a lifelong thing now.
And I think society now as well, it's like the busier you are, the better you are, like the more successful you'll be, or the more people will like you or whatever, but it's not the case.
I would say that's more our generation, not the next.
Yeah.
Those fuckers are coming in lazy as shit.
They'd be like, I'm taking some time to work on
I
myself.
only, like, they apply for a full-time job. Can I do this 3 days a week? That's the next gen.
I see so many good memes of that on Instagram. It's great.
I mean, they're going to be better than us, so I'm not bitching
They're not
about
going to be
it.
stressed at all.
So chill.
It's my birthday. I'm not coming in today.
So that's
Stress is the biggest thing that you found was the issue. And what else have you? I found all like this treatment so different to just stabbing you with a needle for Botox.
Like
go through the other things.
Opposite. So the treatment for this was I started on the pain meds. First thing was seeing a psychologist. So that's probably been a similar amount of time. As soon as I could get in, I was seeing him, and it is a lot of different things, but the main one for me was thought reprocessing, meditation, and breath work. And then I had to go do 2 months of twice a day something called progressive muscle relaxation. So that's tensing your muscles and then holding that for a period of time, and then you have to relax them. So it's kind of getting a bit more in tune with your body and how the two different things feel. So like tense muscles as opposed to relaxed muscles, and like learning how those two different things feel. Because I was like walking around like this, I think.
It's crazy because like looking back, even in the years that I've worked with you and coached you, you have always said like, hey Bex, how's your weekend? Then you go through everything you did on the weekend. You don't like sitting still. Like you don't. And it's like, Mitch wanted to relax, but no, I moved the house around again. Like you don't like being still. So it makes sense.
Yeah. And getting better at it, definitely getting better at it. But there was a time where I couldn't sit down until I'd done whatever I'd set myself for the day. And it's just my own expectations that I'm putting on myself. Nobody was telling me you need to do this. If anything, people were saying stop.
Can you please stop?
Like Mitch especially, like sit down. Oh my gosh, you're stressing me out. But it's just my own. I was just putting stuff on myself And I still do it now. Like, I still expect to do X, Y, Z before I can like reward myself. So yeah, it's just more unlearning. But the progressive muscle relaxation was the thing that I saw the most impact from.
That's cool.
That and the thought reframing, which is just ongoing. It's like an ongoing thing. A lot of work on self-compassion and things like that, and just how you talk to yourself. So all head stuff.
Yeah, makes sense.
Yeah.
Question: do you know much about this progressive relaxation thing? Trajectory. Why did she have to learn that? And isn't that something that we should? Is that something that we should all do and know how to do? Or do you think that's something that a lot of people would actually struggle with in the background? Like, what do you think that is?
I think for Becky's personality type, and mine probably as well.
Are you talking to yourself, mate?
We're psycho. Very like highly strung people. Like Beck said, often walking around like on all the time and never having that down. And when we're on all the time, our nervous system is working always really, 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 really hard, and like it never gets a chance to rest, which adds to that like stress bucket we were talking about before. So forcing yourself to be like, this is on, this is off, is huge. We use it all the time for chronic pain stuff.
Interesting.
Yeah.
So a lot of people unlearn something that should be a natural thing. Because of the way we function.
And I think also part of it is probably like the mindfulness that has to come with that. Like you're sitting, not doing anything else. Yeah, you're not working, you're not on your phone, you're not thinking about anything else.
It took you a long time to be okay with not working.
Yeah, it's not something I'm very good at.
Yeah. You've gotten better. Yeah. Or you're just hiding it from me better now.
We'll talk about it later.
She's like, don't tell me that we're texting on a Sunday.
We often text each other on on our days off. I'm like, don't tell anyone we're talking right now. This conversation never happened.
I banned Sunday work days, and you two are probably do.
Fuck you, Amanda.
Both naughty girls. So.
I'm like, oh, they work so hard and so good. I wish they'd stop.
I think part of that not switching off is the feeling of, if I'm just sitting there relaxing, I'm not being productive. Like, what am I doing?
You're not doing anything.
Yeah, I'm not doing anything. I'm
When
not being
did
productive.
that start? Like, was it just the way you guys are made? Because, like, fuck, I love doing nothing.
I cannot sit and watch a movie
Yeah.
or a TV show. Like,
physically, I love doing nothing. It's hard for me to like turn this off, but I feel like this doesn't like on like if I say to Jordo and like, you know, maybe it's the mum thing. Maybe it's the mum thing. I don't know. I need a fucking minute. I need you to take that child, and I need you to go the fuck away from me. And then I just want to be alone.
yeah.
Maybe I don't know.
Yeah.
But
I
like,
think it must just be hardwired from childhood. I don't know. It's hard because that's something that he's asked, the psychologist has asked me to think about. There's core beliefs that are in you that are set in you from childhood. But when I look back to my childhood, I'm like, well, there was nobody there telling me, but I don't think it's that obvious. I think, or it can be from traumas or just learnt behavior as well, I think. But it's finding out what those core beliefs are and why, and they might have benefited you at one point in your life, but they're probably not helping you now. So, but it's really hard to dig that deep. You've got to dig pretty deep to find out what that is.
It's hard when you squash all your feelings down to keep digging that low. Still going.
You guys should dig for each other. Maybe your shovels will work better if you're doing it for someone else. Yeah. Seriously.
Working hard for you.
Fuck's sake.
This has turned into a counselling session.
This is like...
No, this is turned into, I feel like I'm a fucking terrible boss. I feel like everyone just thinks that I work you two into the ground. They're doing it themselves.
Oh my God.
I want them to stop.
She's begging us to stop.
Yeah, it's
I think,
definitely not
I
you.
wonder if it's counselling session ongoing. I wonder if it's what you were saying before, that positive reinforcement you get like as a kid. going to school and working really hard and getting a good grade and people celebrating that.
This makes sense.
And people...
Because I didn't get that. That makes sense.
And then you identifying then as being like really bright or really hardworking. And then that kind of, I don't know. That's what I feel like mine is.
Yeah, I think that makes sense.
Yeah.
Yeah.
Because that's that became who you are.
Yes.
That's like, it's like when they say like lots of different parenting things with Callie I've learned over the years is like, don't say to kids, I'm so proud of you. You've got to say, are you proud of yourself for that? Like,
Never. Yeah, interesting. Yeah, that
And it's
generation's
like
going to be so much better.
so much better, hopefully.
Yeah.
Because you're trying to get them to appreciate what they've done, them not looking for an external appreciation.
I'm like, someone love me.
Someone tell me I did a good job.
Yeah. Someone clap for me. Yeah, it's really interesting, and like you said, totally, it's not sticking Botox in my neck and hoping for the best. Like, it is mind blowing what this stuff, the stuff you work, if you're working on your mental health, and how that directly affects your physical health.
Like, crazy.
So my neck, this movement that I have no control over, is happening from my brain.
Own thoughts.
Like
thoughts and feelings and
like, and all that
what you've squashed down
stuff. Yeah.
So interesting.
Yeah, it's so interesting.
I find coaching a really cool, like, I feel like you can see into someone's soul when you coach them, and I would say I have seen an improvement in you over the years, because I would say you could see written on your face in the early days the self-talk that would happen to you in a workout is you can see it from a mile away. It wasn't very nice. I think that's improving with time.
Yeah, again, like will take time. I think I do well sometimes, and then other times I'm like, oh, nope. And then the face thing, like the tension in my face, you're like, you've been right in front of me before going, relax your face. I'm like, I can't. Like, relax.
Because she's like this. While she's working out. She looks so stressed.
I love this.
You got to chill the fuck out, bro.
Yeah.
Have a breath.
You've been such a good patient though, like just watching from the outside, the way that you've just like, I don't know, taken everything in your stride and done everything that everyone has asked of you. Like, that's why you're better. The way you're getting better.
I think
most people don't do that.
Yeah. But for
Really?
me, it was like,
Nah.
really?
That's sad.
Imagine if you told someone who had pain, like, go see a psychologist. They're just like, oh, you think I'm crazy? Like, it's just so hard to make that connection for people. Yeah.
That makes sense.
Yeah.
I think for myself as well, I was at a point where I will try anything. Like,
yeah.
this is really impacting my life. And it got to a point where it was happening in everything. So I'd like pick up a laundry basket at home and it would happen. So it was like constant. It wasn't just in here anymore. It was like, yeah. So I was definitely had gotten to that point. Maybe it just needs to get
Maybe you just need
bad.
to hit rock bottom before.
Yeah, I remember one of those conversations with you. I couldn't believe it after you told me that, like, because I always just thought it happened with, like, in the gym. And yeah, I remember one time you told me, like, you have to try to think about your head not turning to the side when you stand up off the toilet.
Yeah.
I was like, holy fuck, that must be
Exhausting.
just exhausting.
Yeah.
Just so done.
And sometimes you wouldn't see it. So someone walking past you while you're lifting something off the ground wouldn't necessarily see it, but I felt it every single time, the tiniest little movement. So it was, just all consuming.
And then you mentioned before you did the strength stuff, before you went into that, it was happening a lot in class and you thought everyone was looking at you. That hit you pretty hard. That hit you harder than I thought it would have. And easy for me to say on the outside looking in, but I had to say to you a lot, no one even knows.
Yeah.
No one can see you. No one can tell. No one knows what's going on. But you had convinced yourself that
Everybody was,
what's wrong with
at
her?
The freak
Yeah.
in the room.
Literally, she was fucking off it.
Yeah, because it's so,
So
like,
big
it's
to you.
all you're thinking
Yeah.
about. So in a workout, 80% of my thinking is on my neck, which leaves 20% left to think about technique, pacing yourself, like what's next, counting, like, yeah, it was just taking up everything. So if I just felt like everyone else was also seeing this thing, and people would say sometimes, so people did notice it.
What'd they say?
Also found that hard to know what to say.
I
Or
fucking
I'd say-
know.
Yeah.
Well, sit down. My first psychologist.
Because it like, what do you say? Especially when nobody knew what the hell was going on.
Yeah, you had to have an
You
answer.
don't have an answer. It's like, it does happen sometimes. It doesn't hurt. I'd sometimes say stuff like that just to reassure people that
I'm
you know,
okay.
I'm fine. But yeah, it sucks that it's happening. I think people would mostly just be like, "Oh, did you know that your head does this?" Or
Yes, I fucking feel it.
I didn't have any idea. Thank you.
Well, I mean, it started out with not knowing, so
Yeah.
yeah, it makes
but
sense.
it would hurt. It would hurt so much. It'd be like, see, it would just be that
They
one
are
thing
looking,
would
yeah.
like reaffirm that thought that everybody is looking at me and
Yeah.
wondering like, what's wrong with that person? Why are they doing that?
Yeah.
That at that time when I went and did kind of like my own training, that was helpful then. But then I also got to a point where I was like, I want to be back in classes. like tantrum moment. I think probably after I remember one open, I don't know what year it was, maybe like 23. I was just like, fuck it. I'm just going. I'm just doing it.
That's right.
We were
remember
like-
that. We were like, oh god.
Yeah.
It's like, I am on the fuck it train.
Me and Candace were
fast.
worried. We were nervous for your well-being. Becky's like, all right, guys, I'm just going to see what happens.
Yeah.
I'm going to do everything.
Like,
and
oh, you want to row? Okay.
we were like, okay.
Yeah. And that would have been so hard, but I think
We
I
had
just,
to, we had to let you go. Like, you're a big
stamped
girl.
my foot down, like, got to some other moment where I was just like, this is what I'm doing. Yeah.
You got to
and-
go through it, and like it's almost like a grief process in
Yeah,
itself. Hey,
yeah.
like you
Yeah.
have to feel like you've got some control, and
Yeah.
And like decision. Like
Yeah.
yeah.
And there would be things that would be like, all right, not today.
Yeah.
Like, not doing that today.
and you were never
that is
disrespectful,
bad.
but you were always like,
Yeah.
Firm.
Yeah.
I'd like to try that.
Yeah.
Sure. Enjoy.
I'll be here if you need
Yeah.
But I will say, in the time when I learned how much it mentally affected you in classes to feel so vulnerable in a class environment, one of the things I learned in that time from you talking to me about and being so open with me about how you felt with other people, I think one of the things my biggest takeaway from that is how everyone would be similar, but with their own shit. Like, not everyone, but I'm sure there would be other people experiencing some, whether it's physical pain or not. Maybe it's how they look. Maybe it's a new pair of pants that they're so self-conscious in. They think that everyone's staring at them because, it just made me really aware that everyone has just something going on that's so big in their own head
Yeah.
that it's all consuming.
Yeah.
Or it can be, not everyone, but
Yeah.
that was really, big eye opener for me in that way.
Yeah. And now, that was like maybe a year ago, the fuck it train.
Yeah.
Probably.
So I feel like I've got I feel most in control of what's happening now than I have in the last 7 years. So I think that in itself does make a huge impact as well. And it's not something that's just going to be fixed with Botox or a tablet or anything. It's just going to be an ongoing thing now, and there'll be it could get better. Like they say, you can fix it, you can work on it and get better. But I think it will just be, there'll be bad times, there'll be bad times. There'll be times when I can do pull-ups without it moving, and then there'll be months where it is happening again. And I think that that's just how
Ebbs
it's
and
gonna
flows
be.
of life,
Yeah.
and
Yeah.
like you said, all the other factors that will affect it moving
Yeah.
forward. I think similar to my autoimmune disease, it's like you have to constantly be aware of when you get a symptom, what's going on.
Yeah.
You just have to know.
Yeah.
Like,
And you usually figure out fairly quickly.
I'm getting better.
Oh, yeah.
Candace is getting better at telling me when she
telling
knows.
me.
This is your first sign, isn't it?
This is your first warning.
I know, Candace. I don't say that. It's fine. But yeah, I think it's pretty cool. Like, I think it's really cool that our bodies can give us warnings in a physical way because we won't listen to it mentally. So it's like, listen to this, bitch.
Yeah.
Let's try this one.
Yeah.
Candace has yet to listen. No, you're doing great.
Trouble.
No, it's fine. But I think all of this, like, as shitty as it has been for you, is going to make you such a good coach, because going through this stuff and dealing with it in whatever way you've managed to deal with it, like, you just get so wise from this kind of stuff, I think. And like, you just know how to deal with people who have injuries, or how to talk to someone who's struggling, or whatever it is. Like, good things come from the shit stuff.
Yeah, definitely. And I don't think you can see it when you're in it, but
Yeah,
I'm
on the other
starting to see it. Yeah, now looking back, everything happens for a reason, even the shit stuff. Yeah.
Is there anything, before we wrap up, we've been chatting shit for a while, is there anything else in any other ways apart from the pain and the actual movement? Is there anything else that it affects? Like, is there any other symptom that is known that it affects you in different ways?
For me personally, or FND, like
You personally, and if there's...
no, they're the main things: pain and then the spasm. I've noticed it's changed, like it has changed, but it's ultimately like the turn to the right. It has been like fast twitches before. It has been slow, drawn out turns and things like that. So it's changed back and forth. But other than that, no, not really. When I was in a lot of pain, sleep was really bad, but the medication that I'm on now, it's very good for getting me to sleep.
That's nice.
I'm like, boop.
Perfect.
But then I also have to, the side effects of that is that, like, sometimes if I take it too late, I'm so drowsy the next morning.
Wasn't there a day recently where you were like...
She's like, I'm so tired. I was like, what time did you take your tablet? She's like, 9:30. I was like, Becky!
No! You shouldn't have driven here.
It's basically drug driving to work.
So funny.
So things like that I have to look at. But FND, it looks different on everybody. It's such like a wide spectrum of people. The disorder itself is like a huge umbrella of... Underneath this umbrella, there's like so many different symptoms, types of people. It can affect anybody, and the symptoms are going to look really different. And sometimes you can't, as an outsider looking at that person, you are like, I don't see anything. And I think that can be really hard for people to get diagnosed with this, because you can't see it. There's no physical like problem. It's more of a kind of software problem inside. And what was I going to say? Don't know.
Must have been a lie. Is there anything you want? So now people in the gym that didn't notice after listening to this, they're going to see it. Is there anything, like, do you want people to talk to you about it? Do you want people to not talk to you about it? Like, is there anything you want from this conversation for you, especially in the gym moving forward?
Yeah. For me, talking about it and giving it like time is not helpful and can make it worse. But talking about it is also good. Sharing it with other people is also good for me, because it takes away that kind of barrier of what I assume they're thinking about me, when people are just interested and they just want to know. So it is helpful for me to share it. So yeah, if anyone wants to ask about it, I don't know. I don't really have that much information, and the story is so long, so it's hard to kind of like make it a short answer.
Just send them a link to this podcast.
Google FND. But yeah, if people want to ask, they can. But also, I don't want it to be me.
Yes, you don't want it to be
that
your
isn't what I
identity.
am.
Like,
yeah. Oh, there's the girl whose head does that weird head thing.
yeah.
I don't want that
Yeah.
either.
And time and place, like I know for me, like if I'm in a class and I've got some kind of ailment and it's before a workout, I don't want anyone to be like, oh, how's your knee? Like, don't talk to me before I do the fucking workout. So like time and place will be like after the workout or, you know, when you're just cruising around, like not like while you're doing pull-ups. Hey, Bex, tell me about your neck.
Yeah.
Time and place.
Yeah, definitely.
Cool. Anything else you want to add to it about it?
I don't think so.
Nice.
We've spoken for a long time.
Everyone's trying to wrap this up. Oh yes.
No,
I'm having
I need lunch, so yeah, that'd be
I'm having a
great.
good time. Okay. No, I don't really have anything else to say. You're great. You're awesome.
Thanks.
You're great. Like from where you first started in 2016 to now, like I'm also so proud when I look at you coaching. I just think it's the coolest thing. Like when you first started in 2016 and couldn't stand up your own air squat, no chance I thought you'd be a coach back then.
Yeah, and this was never the plan either. This was never on my wavelength. It's just kind of happened this way. And then even the type of people that I'm coaching as well is all
very
been
niche.
part of it. Yeah,
it's very cool.
Niche.
I love
client.
Yeah, and yeah, you're very passionate about it. You're very good at it. You're very willing to learn. So you got to just keep getting better and better. And yeah, you're a great, just member of our community. Just great.
Thanks.
You're just all around great.
Just great. You're great too, Boo.
So you're pretty great too. Okay, let's wrap this up. You have 30 seconds to tell me your bright spot for the week.
It's Jordy's birthday. We're going to get Yochi.
Oh, she looks nervous.
You gave me 30 seconds. I answered it in 3.
You did.
Yep. That'll do.
Do you have a bright spot?
I'd say my master's class on
Cute.
Thursday. It was very cute. Shout out to the master's class. Judy, Scylla, Rose.
Can we make
Vicky.
this their gang song? Shout out to my masters, yeah. I really wish you put on the accent a bit harder then. Vicky, you're fucking killing it.
What amazing. Yes, they're very, very lovely and just, brighten up my morning.
I love walking in when you're doing masters. It's
very
a great
cool.
day.
Yeah. And they're absolutely just putting their all into it. Like, you think that people are going to hold back, but I'm sure it's the same in normal classes as well. And I've coached a couple of Saturdays and stuff. People just work so hard, and like you just stand back and it's like, wow, you guys are amazing.
It's cool, huh?
Yeah. They're masters.
Love it.
Cute.
Bright spot.
Mine has been all the little kids going to school this week. We've got so many like gym babies that have been here since they were in the womb, and now they're at school.
It's pretty nuts.
It's
this is
so
probably the
cool.
biggest year of preppies that we've had. I think 8 or 9.
Maybe 9. Yeah. It's been so cool, and especially like a couple of them that I've gotten to know quite well, and just like seeing them grow up and go to school.
It's pretty nuts.
So cool. So cool.
I don't like it. Makes me uncomfortable. Everyone's growing up.
Yeah.
Time. Like time. It's just nuts. Just blows my mind how like kids are they show how fast time goes.
Yeah.
Like little kids from a baby to a 5-year-old. Like
Wild.
it's only 5 years, but it's so much. Like
So much change.
so much. So it's very it is very cool. That's a good bright spot.
Yeah.
Do we do anything else, or is that it?
That's it.
No, we've already done our question. Yeah, nice. All right, well, if you two could promise me you're not going to work this weekend, that'd be... They just winked at each other.
Nudge, nudge.
Wink, wink, nudge, nudge.
Message on Sunday. No, I'm kidding.
All right. Love you. Bye.
Love you. Bye.
Yeah.